Thank you, Ceann Comhairle. Taoiseach, letters from the Chief Executive Officers of 4 of the largest hospitals in the state to the Director General of the HSE and revealed by last evening's primetime programme illustrate how untenable the current government's strategy and budgetary strategy in particular is for the health services. Clearly, the letters indicate that the centre simply cannot hold if the government proceeds with cuts of up to 666 million to the health budget. Now, we're talking about the CEOs of St James's Hospital, Tala, the Mater Hospital and Our Lady's Hospital in Crumlin. And basically they are saying, Taoiseach, in a nutshell, that the quality of services and patient safety is being compromised right now and will be irreparably compromised if these cuts go ahead. Taoiseach, it's about access to services and it's about patient safety. And they're saying all the demands being put on the health service and on hospitals, in contrast with the budget, is leading to undeliverables in terms of the objectives and undeliverable imperatives. And they've also alarmingly pointed out, Taoiseach, that there are now delays in cancer services and that cancer patients are being delayed. In essence, what the progress has been achieved over the last decade in cancer care is being dismantled as we speak. And this has been added to by consultant Owen Smith this morning, who's confirmed in Morning Ireland that children and teenagers are having treatments delayed, and that given in many instances the type of cancers that they have as young children, timely interventions is critical. And they're not getting those timely treatments. And he made it clear that survival and outcomes are being adversely affected as a result. And Taoiseach, the CEOs are saying in essence that the implementation of your budget proposals will lead to, quote, a serious dysfunctional and damaging outcome. And, you know, I want to put it to you, Taoiseach, and we asked you before here for months, we raised the whole issue of discretionary medical cards, and you put your head in the sand and we had denial after denial, week after week. Do you accept, Taoiseach, that services in our acute hospitals and patient safety is now being compromised as a result of budgetary policy, and that provision of cancer care is being dismantled? And are you determined to proceed with the scale of the budget cuts in health that you've announced?
Thank you.
Well, the budget this year in health is 13.263 billion. There's a capital fund of 357 million in capital, and the total savings, as you know, are identified are over 600 million for this year. There is no doubt, everybody understands this, that this is a very challenging year for the health service. Minister O'Reilly is operating with a budget of 3 billion less than 2008, with 10,000 fewer staff. And he's changing the structure of the way health services are delivered in the country in terms of the cost of providing those services, but not the services themselves. I reject your assertion that that patient safety is not a priority of the government. It is the absolute priority of the government and the minister. I note the letter that has come in from the 4 chief executives. I understand this was delivered yesterday. Clearly, the obligation and the legal responsibility following the budget being delivered, Deputy Martin, as you're well aware, is for the Health Service Executive to prepare a service plan based on those budgetary figures. Because of all of the challenges that are here, the Minister has given extra time to the Health Service Executive to prepare that service plan. The presentation date to the Minister is the 15th of November. I note at the end of the letter from the 4 chief executives, we would urge that the implications of continuing in this vein be recognised and that constructive engagement with the hospitals in the budgetary formulation process be pursued. And that's something that will happen, obviously, in the preparation and the determination of the service plan being prepared by the Health Service Executive. I listened this morning to Mr McCormick from the Cancer Service, and he indicated that he wasn't aware of delays that you have mentioned, which were referred to in the broadcast by a medical doctor, and clearly the cancer services are available for people on a regular basis to offer assistance and support. Now, as I said, between January and August of this year, the number of patients waiting on trolleys was down by 30% compared to 2011. Consultants now see and discharge patients on a 24/7 basis. This saves the state hundreds of millions. That's an issue that was not tackled in the past. the biggest reorganisation of Irish hospitals in the history of the state was announced in May. I might say that the HSE took a new approach this year, Deputy Martin, to determining hospital budgets for this year. For the first time ever, budget allocations were actually related to projected spend rather than on historic budgets rolling forward from previous years. And as a consequence of that, the Mater Hospital received a 5.7 increase in its fund for 2013. Tallaght Hospital received a 2.8% increase in its budget for 2013. There was a reduction in James's and a slight reduction in Crumlin. But the budget figures for the hospitals were for a 3% increase this year, and hospital managers are expected to manage the hospitals that they're in charge of based on the figures that they've got. So the budget was for a 3% increase in hospital funding for this year.
Taoiseach, your reply follows a well-worn pattern at this stage, just denial after denial. I mean, these CEOs are Conservative people. The last, actually, type of people to come out with a letter like this to the HSE. And the letter is very carefully written, Taoiseach. But if you decode the letter, what they're saying is very clear, that they cannot take any further cuts to hospital budgets and that they cannot stand over patient safety in the current climate. They are saying, Taoiseach, when you decode this, that patient safety is at risk. Now, Dr. Owen Smith isn't any ordinary medical doctor, Taoiseach, and I wouldn't second-guess him if I was you. He's been a principal leader and pioneer in the area of childhood cancers and teenage cancers, and he knows what he is talking about. And he has said on the record that there are delays in treatment of young people and children. That is what he's saying. And he's saying outcomes are being compromised right now, Taoiseach. So can we have less of the denial, Taoiseach? And what I'm saying to you, Taoiseach, if you proceed with the cuts that you intend to proceed with, and by the way, which no one can actually pinpoint at this stage, because the figures were handed by Minister Howland to Minister Riley, take them or leave them, 666 million. HSE came back and said it'll be $1 billion before we're finished. Taoiseach, you're getting a lot of warnings. The system is saying to you, we can take no more. And we certainly cannot take cuts of this scale, because if they go ahead, patient lives will be lost as a result. And you better get that into your head. Intervene and change tack and change policy and change your direction. Will you do that?
Taoiseach, thank you. I called the Taoiseach, by the way, in case you didn't hear me. Thank you. Taoiseach, thank you.
I think the path that we have set out here is to change the structure of the way health services are delivered in this country, to cut the costs of delivering those services, but not the quality of the services themselves. And I reject again your snide assertion that patient safety is not a priority of the Minister for Health or this government. So if you're in the business of second-guessing, mind what you say yourself. Now, the point about your own record, you went from 3.6 billion to over 15 billion expenditure in health. And we had all the answers when you were over here, that we're going to have world-class services and an elimination of all these things. And it might be of interest to those screeching behind you that you yourself spent 13.8 million on management consultancy. And you had to be bailed out when you were Minister for Health to the extent of €664 million. The mess left behind by you has got to be changed here. I do not second-guess the eminent consultant who spoke on the radio this morning. I was merely speaking about Mr. McCormick, who delivers cancer support services to patients who need them.
Thank you.
And I point out to you again that the budget for this year for hospitals was a 3% increase. The Mater Hospital and Tallaght Hospital both received increases in rebalancing their budget. So it's not the same old story, Deputy Martin. It's a case here of cutting the costs of services, but not the services themselves.